So every day is different. I have been trying to work out in the mornings for two reasons. One is it just helps me get going. And number two is I've been in my career for 10 years. I'm starting to recognize that I need to stay healthy to do this long term because it's kind of grueling. Try to stay in shape, but here we are. Walking is my favorite exercise, and skiing and basketball. And this is my car. My kids ask me when I'm ever gonna get like a really nice car, and I say, well, I already have the nicest car because it's a Buick and it's safe and smooth and you can't get pulled over because it doesn't really go fast enough to speed. Neurosurgery is a team sport, so it would be not appropriate to show a day in the life of without highlighting some of the people involved because it's not just a one-man game or one-woman game. But my best learning for basketball jumping has been Instagram. So now when I pull my Instagram thing up, it's all jumping videos. Since we're at the surgery center today, we really have to have the imaging be accessible on the cloud. There was one image that I took a couple of screenshots of it just on the off chance that we couldn't pull it up. Because you have to have imaging when you do the surgery. At the surgery center, we would do like discectomy, sometimes 3-level anterior cervical fusions, disc replacements, SI joint, and spinal cord stimulator. So we do sort of the more outpatient cases. The mornings that I work out and then go to the hospital and do surgery feels so much better. Like my body just feels so much better after that. Yesterday I did 6 cases at the hospital and 3 that were admitted to the hospital. I'm gonna go see on rounds this morning, and I think I'll be able to discharge the 2 patients that had lumbar fusions. Tomorrow I'm back at the hospital doing surgery, so the surgery center days with rounding are a little bit trickier because you've got to go to a couple facilities. If I'm just at the hospital that day, those days are simple because I live 3 minutes from the hospital. This is the high school I actually went to right here.
How does it feel to be able to get back to the community you grew up in?
I always kind of hoped it would be a possibility. The longer I'm at it, the more connected I feel to the community. It's almost the exception to the rule to have a patient come to clinic that there isn't some kind of a connection to. I really like the connectedness of the job. It's one of the most enduring sources of joy in what I do, is how connected it is. I was born in this hospital. They rebuilt it about 5 years ago, and it's beautiful. I don't know that there's a hospital with better scenic views than this. I need to grab my badge. Sometimes I forget the badge. Then you're stuck. Okay. So there's pictures in the whole hospital, and a lot of them have scenes from Utah's landscape. But on the left here is Dr. Tracy Hill, and he was the chief medical officer of this hospital, a pulmonologist and intensivist. And when I was 12 years old, he walked up to me as I was laying in the grass after a baseball game and said, Johnny, I'd like you to be on my all-star baseball team. It was like the greatest day of my life. And so we stayed connected, and when it was coming time to decide what field to go in, I talked to him, and he said, we really need neurosurgery here. And I was like, okay. So I walk past this picture every day, and I'm reminded of partly some of the history of why I'm here. When we're in between cases, a couple times a day, we'll just take a little break and go walk around the pond. They did a really good job intentionally designing a space for patients and caregivers to decompress and get a little bit of sunshine. It's a little bit of a social hour at lunch. You can see people and talk to them. So I'm gonna go around and see some patients, and then we'll meet back up and drive over and do some surgery. So. I'm just pretending I'm doing something important, because if you're on the computer in the hospital, it means you must be doing something important. Looking up some patient imaging. Brandy set me up for success yesterday because she put a lot of the orders in for discharge. When I round early and then go to the surgery center on the days that we do this, you always see the people coming in. They're like, where are you going? I'm like, I'm not here today. I tweaked my neck just a tiny bit in clinic on Tuesday doing pull-ups. I just hopped on there and I wasn't really warmed up and did a bunch of pull-ups and then I was like, oh, I could feel just this tiny little twinge, and then you get the muscle spasm around it, so my neck's just a little bit stiff. Morning, how are you?
I slept in.
Oh, good for you. Yes. Every day is different. There's some things that are common to every day, but each individual day is different. Finished rounding, patients are doing good. Now we're gonna go to the surgery center, do some cases. I think that there's about 200 or so residents every year that graduate in the United States. And Utah's a small state with maybe 4 million people. I don't know how many neurosurgeons there are in the state. Right now there are 4 in this community. And then you have this growing community. And the number of neurosurgeons in this community has basically remained the same for several years. It feels a little bit overwhelming sometimes. Every single day, somebody's texting and calling and saying, hey, somebody's in trouble, can you help them? And I'm like, well, we can try. we want to, but also don't want your doctor to be burned out. And I want to make sure that I get home to the family, spend time with them every day and stay married and all of that. So we have a now 19-year-old, 16-year-old, 12-year-old, and 6-year-old. And then last summer we had a newborn. So for us at home, it's never been busier because you have a kid going off to college and a baby in diapers and getting into things and crawling and making sure that she doesn't like fall down the stairs and everything in between. High school, middle school, elementary school, preschool, tennis, violin, Chinese immersion, piano. It's crazy. It's so crazy. The neurosurgical practice is so busy. And I actually started my own practice and helped to run it at an administrative level, although most of the work is not done by me. It is a great, fulfilling, and very busy life. Usually when I'm in the car, I don't listen to any music. I don't try to do anything but just sit and enjoy just some quiet. I may or may not have time to go home before going up to Sundance. And I'm going with Josh. So we have the surgery center cases, and then the hospital once a year does like a provider appreciation night. I'm also going up there to connect with a few people from the hospital. So a lot of times you find yourself fulfilling multiple things at once. I don't think you ever find like this magical balance in all of the things, but maybe you can find some degree of harmony where things just kind of fit and flow together and you just kind of do your best. I leave my ring in my car because you can't have it scrubbed in, and then because I was worried I was going to lose it. But 21 years and I haven't lost it permanently. Morning. That's the way I like it. Biggest case of the day to start off with, so get that done.
You did a good job on me, so you know, I can't like.
Oh, you weren't giving that to me?
I wasn't.
No? Sizes are a little funny. And they have every size that you don't need. And if it doesn't work out, it doesn't work out, but it'll be nice, to be able to use basically 5 sets back and forth on these days when there's just tons of lumbars in one day. Scott Perry and his team, we've worked together for 10 years. Ever since I started practice. We even started talking before practice started.
Yeah.
So
11 years,
we're going
years.
strong.
Still going
And
strong. Another 12
yeah.
years, maybe 20.
It's definitely a team effort, right?
Yeah, it is. Yeah, a lot of moving
You guys
parts.
do all the work and I don't do anything.
You keep us busy. And because she keeps busy, we stay out of trouble, and the neuro playlist.
Shani's she's the radiology tech.
Hi.
And she's awesome.
Hi.
And when she's in the room, it's like you have a radiology tech and a second circulator, because she just helps with everything that's needed. It's amazing. So we request her when she's available, right?
Well, yeah, and I appreciate that.
Yeah, it's been fun. But yeah, in the room there's anesthesia, scrub tech, radiology tech, circulating nurse, assistant, which is Brandy today. She's a PA, and then whoever's needed for hardware, which is usually Scott Perry and his team. So it's pretty much a party.
It's fun.
It's fun. Get back to work. Cheating the system. Yeah, you can go up and over. Table down. Ray Tech. Oh, that's so good. Thank you. Knife. Thank you, Todd. Thanks for coming and helping. I'm just going to pretend that they're not there. Thank you. Yeah, we got to have music. Should I refrain from cussing a lot because it's on video?
I'm not allowed to make any of my normal jokes, so.
Brandy pretty much can't. She can't say anything. If you can't say something you don't want seen on YouTube, don't say anything at all. Can you slide down for an X-ray? Table up. Thank you. Will you on that sagittal scroll back and forth just a little bit? There's a big spur. Other side.
That's at 5'6", right?
Keep going right there. See how that first tall disc has that big spur on the left?
Yep.
That's the first disc we want to fuse, right? So, does everybody agree that's 5?
I agree. That's
Okay,
5.
you can go. We always have everybody in the room count the levels, especially when there's funny anatomy. That's good there. Thank you. Oh yeah. Now we're talking. Microscope. 3 kerosene. Oh yeah. May I have a 3 kerosene, please? Why, thank you. Ella was so cute last night.
What was she doing?
Oh, we went for a walk and.
The big girls can say hi?
Yes. Gosh, Dr. Edwards is struggling again. You're almost there if you just give it a little bit more effort. Knock, knock. Who's there? C4.
Sorry.
Distractor. I think it was a facet arthropathy at this level because you can see it on the X-ray. It's a horrible facet joint. So we don't have to decompress a lot. Just fuse this level mostly. Gary's legitimately funny. I just try hard. We did a 3-level ACDF, and now we're going to do a discectomy. And you always dictate right after surgery so that you don't have to do it later. Thanks for that with the bipolar. That was great. Postoperative diagnosis, same procedures performed: anterior cervical discectomy and fusion, C3, 4, C4, 5, and C5, 6. We used interbody cages at each level. We used allograft for fusion. We used an anterior cervical plate and screws for fixation purposes. I've gotten into this habit of just doing a little stretching every time I dictate because you're standing all the time, and it's been great. Done. All right, enough talking. So Brandy's got us ready to go now. I'm ready. Put me in, coach. This is me scrubbing in. And that's why I cheat the system. We're going to clear this little area out so that, and you can see right here, as this nerve passes through this area, it's pinched. So a lot of the surgeries that we do in the low back are to address issues with pinched nerves. She has a tiny bit maybe of a slip, but not much. So we're not going to do any fusions or anything. We're just going to clear this out. We talk about two principles, one being we want the patients to be mindful of their movement. So gradually, mindful of their movement, like paying attention to how they're moving and how their body feels. And then the other one is incremental. So the physical therapists will say that injuries happen because of doing too little for too long and too much too fast. So mindfulness kind of keeps you in that middle ground, and incremental allows you to also stay sort of pushing yourself a little bit, but not too much. I feel like my whole life's led up to this moment. Best day ever. We literally say that every day. I went for a little while where I didn't say it.
Yeah.
Because I was depressed.
It was also for a year.
What do you have to be depressed over?
I stopped saying it was the best day ever, so I was depressed about it. So I had to start saying it again. Why is the garbage all the way over there? Yeah, it's just an efficient use of time to be in two rooms, because there's quite a bit that has to be done in between cases to prepare for the next case. So if there's two teams, I can go from one room to the other, and then there can be not a lot of downtime in between. We don't do this every day, but at the surgery center it works really well, where you're trying to get a lot of cases in that need to be done. It just is an efficient way to get them done.
I figured you could do it without touching this one.
Okay, we can do a timeout L4-5 laminectomy. We're going to dilate up to the yellow or the biggest tubes on this. Okay. X-ray there. Right there. I think that's a mutual arrangement we should make with everybody.
Yeah.
Friends don't send friends to HR. Okay, that's it. Brandy's better at closing than I am anyway. So, the microscope was brought into the field for microsurgery. We did a laminectomy at L4-5. There was a lot of overgrown bone. The medial facet joints bilaterally were resected, and the thickened ligamentum flavum was removed. The bilateral lateral recesses were decompressed, as well as the central canal and cauda equina. You kind of get the idea, right? So every case we see the patient, we go back, we position, we prep and drape, we make sure our films are up and correct, we do our timeout, we get exposure, we bring the microscope in, we do whatever it is we need to do on the particular case, and then we close. We've got to do a few logistical things like paperwork and get it off to billing and dictate, and then see the next patient. So it's this repetitive process throughout the day, and it's just being committed to doing things the same way every time, over and over. It can feel a little bit monotonous, but it's always somebody's loved one. It's always somebody's individual story that we're a part of, and so we've got to always remember that. But yeah, so we're partway through the day. We've got a ways to go, but so far we're doing good, and hopefully I think we'll get a little bit more into the flow of things. We've got a couple of new people here today, so it's just been a little bit choppy, but I think it'll smooth out the rest of the day. So we've been operating all day. We've done a bunch of cases, done really well, and there's one more surgery to go, and then my son Josh here is interested in medicine. He's been spending some time shadowing in clinic, so he's able to come and watch a little bit. So we just have the one more case, make sure the patient wakes up okay, and then we'll head up to Sundance, go to the play. She's so helpful. It's like having another circulating nurse. And Todd's the scrub tech, and Matt is the anesthesiologist up at the head of the table. So there's always anesthesia, scrub tech, circulator. Brandy's like the assistant. Well, it's a wrap. We're all done. I've already dictated every case but this one, so I only have one more to do. It was a good day. I think everybody felt good about it. We didn't have any intraoperative issues whatsoever, which is always like the most important thing. Yeah, it was good. We finished at a decent time, 5:30. It's not bad for how many cases we did. We have to get the close-up on Brandy.
No, I
Yeah.
have post-surgery hair. It's not allowed.
I have post-surgery.
Hey, I have post-surgery hair.
You spike it though, so see if
It's still warm. You know, people say, oh, they're so talented or they're so smart, but mostly what it really is they're just pretty dedicated and work hard.
Yeah.
No matter what you do, to be great at something, it just takes a long time, lots and lots of effort, and over not just a few weeks, months, or even a few years, but maybe a decade or so, or more. Every day's different. Today was great. It was a good day. I feel like the cases went well. It was fun to be able to have Josh come and visit the OR with us. It's a little bit unique to end the day at Sundance, but we'll take it. It's super nice up here. But I hope it gives you some sense of what a neurosurgeon's life can and is sometimes like. And maybe we'll do it again and you'll see a completely different day.